saw in the past, you had seen us 2 years ago, and you had herpes zoster, like shingles in the eye, my dear, okay? What I worry about is it's that same eye that's bothering you again, and I heard it started bothering you about 9 days ago. Is that right?
Yes, ma'am.
Do you have any sort of lesions or kind of irritation from on any side of your left side, my dear?
Currently, you mean?
Yes.
Yeah, a little bit.
You do.
About the time my eyes started bothering me, in fact,
Yeah.
I had a big one on my nose and a few here. There's a little bit left here and a couple on my scalp, but they're mostly gone. They come and they go, and it usually like in a week they get bad and then go away again.
Okay, and then are you on anything like a Valtrex or anything like an antiviral, my dear?
No, ma'am.
Okay, so I want to take a look, my dear, because the only thing is, I'm glad that it's going away and self-resolving. Sometimes if you get this recurrent shingles in your eye, we like to give you a low-grade maintenance therapy so you never get it again, okay? Is it always just that left side, my dear, that you're getting it? Kind of at the tip of your nose, my dear, you're saying on your kind of forehead and on your scalp.
Like this.
Yes.
Yeah,
that's
it's
what
quadrant.
You know why?
And all the way to the back. In fact, I have pink on the back of my scalp. But I've also had some other lesions on my scalp, which I don't know if they're from the gabapentin or what they're from.
So I want to kind of show you, and I want to make sure we're on the same page here, okay? So with kind of herpes zoster, or shingles is what we tell patients, can kind of flare on many different things. Do the lesions kind of look like this, my dear? Are they a little bit bumpy?
Yeah, my regular doctor was stopped in the doorway when he walked in and went, wow, it was so bad.
Got it. When did you see him last, hon?
Friday.
Friday. Did he start you on any medications on Friday?
No, but he did give me this referral, and your nurse called me like 5 minutes later, and I said, yeah, I'll take the appointment.
Yeah.
He was really quick.
The case. I'm going to take a look, my dear, and if I think it is shingles for whatever reason in the eye, I am going to start you on an antiviral, my dear. That should kind of help speed things along there too, because I don't want it to get worse, because if shingles is in the eye, it can scar. Too, okay, and then you're not gonna love me. I'm probably gonna dilate you too. Okay, sorry, hon. Okay.
Well, I'm driving home east, so it's not too bad.
Not too bad. Okay. But the only thing is, my dear, I would rather it, just because shingles can be systemic, we can be nice to you and dilate one eye, but at least I need to dilate the left. Okay?
Whatever you need to do, doctor, is fine.
Since you're already here,
I'll manage.
I always tell patients, sometimes it's nice to dilate both to make sure you're okay,
Yeah, but I don't want to miss anything, so whatever you think.
That's enough. Thank you. You're one of my nicer patients, okay? I only do it because I care, not to torture you, okay? Lean your head back for me, my dear, okay? That's one of my favorites. We actually work together pretty closely, just because we refer patients back and forth to each other. Okay?
Yeah, he's a really nice guy.
I really think so. So I'm going to put this dye, my dear, first in your right eye. I know what's going on in your left. It only gives me a baseline of what quote-unquote normal is, okay? You're going to look all the way up for me if you can. I'm going to tap. Good job, honey. It makes everything orange. You're not going to love me for that, okay?
Oh, I like variety.
Go ahead and blotch your eyes for me if you can, okay? Let me go ahead and see how you're doing here. And then blotch your eyes, my dear, and then we'll kind of take a look, okay? I'm just reading through all of those because I didn't get... I didn't know that you saw him so recently there, too, okay?
Yeah, that was the quickest appointment I've ever had.
Sure, my dear, okay. Yellow spot, no drainage. COVID 2 months ago. The nice thing is he didn't think it was zoster though, or shingles. Okay, so let me take a look here. When you are ready, honey, can you please drop your chin into that chin rest? We're normally pretty good at the eye department of getting you in, my dear, especially if we worry because you had shingles, okay? And look straight ahead.
Well, I appreciate that.
Of course. When you're ready, you're gonna look to your left for me. We don't always stay on time in our clinics though. Towards your right for me. All the way up towards the ceiling for me if you could. Good. I'm going to push a little bit, okay? Let me know if I'm hurting you at all. Can you look down for me, my dear? Good. And straight ahead for me if you could. I'm going to swap over to blue light. Lets me know how dry and irritated your eyes are, okay? Oh, your eyes are a little bit dry here, my dear, okay? Even in your
I'm not surprised about that.
Yeah.
I feel a little irritated.
Do they? I was going to say, you do have a cataract in this eye too, okay?
Good.
Older and wiser is what I tell patients, okay?
Older and blinder.
That too, okay? That too. Let me go ahead and...
Well, I'm the last one in my family not to get replacement lenses.
That's awesome, my dear. My dear, go ahead and look toward your left. I tell patients if you live long enough, you, me, everybody else will get a cataract. Towards your right for me if you can. All the way up towards the ceiling, okay? Down towards the ground for me, hon. And straight ahead for me if you could, okay? Good. Your eyes are quite dry. Blink for me one more time, my dear. The nice thing, my dear, is I actually don't think it's shingles, though, which is the awesome part here, okay?
Mm-hmm.
Good. Go ahead and blink one more time. Good. And then I'm going to switch over to white flame. Tell me, where is it bothersome? Is it kind of towards the side, my dear? Towards your ear?
The irritation?
Yes.
No, medial.
Medial.
Lower.
Good. I'm
just inside the eyelid.
Interesting, because right now, my dear, I'm seeing a little teeny tiny boo-boo on your temporal side, my dear, not on the opposite side there, too.
No, I'm a mess.
Yeah, you're fine. Good, let me go ahead. Blink one more time, my dear. I just want to make sure I'm not missing anything. Let's be safe. Let's dilate just to make sure I'm not missing anything, my dear. And then we're going to start you on a small little regimen to make sure you're okay. Okay?
Okay.
Good. How many times are you putting the drops into your eyes right now, dear?
I got them Saturday morning, and I've put them in only probably 4 times since then.
Okay, so not too often. Okay.
No, it's bedtime. It really is the most bothersome.
Got it. Okay. Makes a lot of sense, my dear, only because that's when your eyes are most dry. You use your eyes the entire day, okay? So only because it's been a while, let's dilate just to make sure I'm not missing anything else.
Sure.
You're okay?
I spend a lot of time on YouTube also, by the way. So
That's okay, which makes sense because that's what you were saying. That was your username.
Yeah.
Too. Okay. Yeah. There's definitely a small little kind of break, but definitely no kind of vesicles or anything that I should be worried about, okay? Let's go ahead and dilate. I'll give you a light dilation in both eyes, so I don't put you out of commission, but enough for me to see inside, okay? So you're not going to love me.
I brought my cane. I should be.
Oh, good. So let me go ahead. A drop in both. They sting quite a bit, okay?
Mm-hmm.
Go ahead and look down for me if you can, hon. Good. That's one more for me. You're not going to love me, okay? Good. Go ahead and wipe your eyes. And
Not too bad.
I'll be back in about 10 to 12 minutes. It shouldn't take long for you to dilate there, okay? And then that way I can kind of make sure that you're squared all the way through, okay? Right now it's about 10:22. I promise I'll be in here about like 10:30. You should be plenty dilated then, okay?
Okay, I'm in no
That
rush.
way I can always kind of double check your cataracts, make sure you're okay. And then I want to kind of give you some treatment in and around your lids here. You do have a little bit of dryness, okay? And I want to kind of show you from what, okay? So give me one moment here. Put your glasses on. This might be most helpful this way, okay? So what happens is when I have you look up and down, my dear, some of your glands are a little bit clogged there, okay? And that's why, my dear, when they're clogged there, when you look at your lid margin itself, my dear, it definitely looks a little bit irritated, more pink and irritated. Kind of has this nice little kind of flush that's going on around your eyes,
gotcha.
okay? So what happens is when it's flushed like that, you start developing these little flakes that line your lids and lashes. They slough off into the eyes and cause a lot of irritation there too, okay? But I want to kind of give you some tips and tricks. Do you remember the brand of the eye drops that you picked up? Can I see them? That's okay. Oh, you're my perfect patient. Yes, I really do like these, but no more than 4 times per day. This one still has a preservative in it, okay? So I like the ones, I know that it's not a big bottle, but the ones that kind of come in the little individual ampules are preservative free, so you're not adding anything to your body, okay? Do you shop at Costco?
I got this on Amazon.
Oh, okay. Amazon works too, my dear, okay. But do you have a Costco membership?
I do not.
You do not, okay. Because I feel like Costco has slightly cheaper drops, my dear, but that's okay.
Okay.
What I want you to do is we're going to do a couple of different things to clean up around the margin just to make sure you're okay, okay? The first thing, my dear, is to open up those glands. I typically like you to kind of warm compress, okay? The thing is, with our glands, just like any sort of pimple on our skin, my dear, there's 3 layers of the tear film. There's an oil layer, a water layer, and a mucus layer there, okay? The problem is if our glands are clogged, every time you blink, your tears actually evaporate because the oil layers aren't going onto the front surface of the eye.
That makes sense.
And then in the morning, sometimes you'll wake up and you'll be like, why do I have so many eye sleepies or like eye boogers?
Absolutely.
It's because that oil layer is not there. Now your water layer is kind of completely evaporated, so you're only left with the mucus layer.
And I have very watery eyes.
Yes.
If I lay back in bed, tears start coming out of my eyes.
You know, it sounds backwards. People go crazy to tell me I have dryness. The reason why you're tearing so much is your actual body compensates. It's trying to produce
make up
more.
For that irritation?
Yes. So it's trying to flush it out, but your front surface is so irritated, my dear, you just end up crying them down your cheek instead.
Yes.
Okay?
Yes.
So what I want you to do is you're going to try to warm compress. You can take a towel and run it under hot water. that's okay too, but always test it on the back of your palm before you place anything on your eyelids, okay? The eyelid is 4 times thinner than the rest of the body, so you don't want to burn it there, okay? But the ones that I really like, my dear, you can pick these up from Amazon, that's why I really like them too. I actually own one of these, but you actually throw it in the microwave for 20 seconds and it stays warm the whole time, so you don't have to constantly heat them, okay?
That sounds good.
There's 2 companies I really like, my dear. I own a mask from each of them, okay? It's called Optase or Brooder, but it's same concept, my dear. You throw it in the microwave for 20 seconds there, and it stays warm the entire period of time.
Cool,
okay?
appreciate the referral.
Yeah, so that's one, my dear. I want you to at least do it 2 to 3 times a day if you can.
Oh, wow, okay.
The only reason why is it's going to help open the gland so you get less crusties. That's one, okay? The second thing that I want you to do is you can still use these drops. I'm okay with these, okay? But no more than 4 times a day for me, okay? I do.
Is that because of the preservatives?
You got it.
Okay.
Okay. So, but I do want you to increase your dose because your eyes are a little bit dry. So once your body starts to kind of get reduced inflammation, you'll produce less tears.
Okay.
Too. Okay.
Oh, that'd be
so
nice.
4 times a day. I always like to tell patients for the next 2 to 3 weeks for me,
Okay,
if you
great.
can. Okay. And then the last thing I want you to do, my dear, this will help you at nighttime the most, my dear. It's actually a small little ointment at night. Okay. So it's almost like Vaseline for the eyes, my dear. So you start off on a good start. So how you do it is you wash your hands, of course, my dear. You put a small little bit on your finger, like a pea-sized shape, very tiny.
Okay.
Pull down your lower lid, my dear, and you're gonna touch that fleshy portion there. There's no nerves there, so it won't hurt. Don't touch your actual physical eye, okay? You will get a lot of nerves there, okay? What happens is it does make your vision really blurry after you put it in, my dear. So just go straight to bed afterwards, okay?
Okay.
And in the morning, you'll just wash your face like you normally
Just the left eye.
You can do it in both, actually. You're dry in both, my dear, but if you're feeling like you're a little bit more bothered, my dear, at least just the left eye, but you can do it in both.
All right, I'll see if I can do both.
So, the one that I really like is called Hylo Night. I actually just recommended it to my sister who's in med school here, okay, and she really likes it. Now all her friends are using the same ointment there too, all of which you can actually pick up online too, okay? The last thing I want to do, this is an optional. I'm going to give you a number 4. I know this sounds like a lot, but this will kind of help with the redness around your eyes there too, okay?
Sure.
The last thing I tell patients, my dear, is there's this thing called, it's called the hypochlor spray, but it gets rid of all the flaking and debris that can cause redness and irritation in your eyes, okay? So I'm going to write this one's optional because yours is really not that bad at all. Yours is very minor, okay? For people who have really, really red, irritated eyes, I'm a huge advocate of this one, okay? So it's a spray that you can also pick up in store or on Amazon, my dear. It's called OcuSoft Hypochlor, but how you do it is you close your eyes, of course, that would be helpful, okay? You're gonna aim the spray bottle kind of at your lids and lashes, let it sit there for 2 minutes, and you're just gonna clean away, my dear. It gets rid of all the flaking and debris that's causing your redness.
Oh, that sounds handy.
I really like it. I actually personally use it daily myself, my dear. You can actually use it 1 to 2 times a day. Yours is so little, so just 1 time a day is plenty, okay?
Okay.
But I wrote that one's optional. Try this, but it should definitely help with that sensation.
Would that be something I do in the morning then?
Your preference. I personally like to do mine at nighttime.
But I'm going to be doing the other thing at night. That's what I wondered.
So that's a good question. So what I do is I just spray it on there, my dear, at nighttime, my dear. I kind of let it sit, wipe
It's
away.
on the surface.
Yes,
Okay.
exactly. And the other one's in your eye.
I get
there
you.
you go. Okay, so you're right. So I'm going to write that this is topical, okay? Hopefully you can read my handwriting, that's half the battle, but I will write it all in your chart notes. You're starting to dilate, so let me take another peek inside to make sure everything else is okay, okay? So, let me go ahead. I'm gonna write this all out. I promise I'm pretty good at flipping charts the same day, okay?
Oh, I'm in no rush. I know you're busy.
Oh, you're so sweet. I appreciate that, okay? But just in case you can't read my handwriting, you'll be able to read it on your charts, okay? All right, take off those glasses, hon. I want to do that orange dye one more time to make sure I'm not missing anything, and we'll take a look inside your eyes, okay? But this could definitely help with that foreign body sensation that you're exhibiting. The reason why you get that foreign body sensation is the cornea, or the front surface of the eye, has a bunch of nerves there that are just more than your spinal cord. So sometimes when you even get an eyelash in the eye, it hurts a ton. That's the reason why, okay, hon?
Makes sense.
If you're getting a huge bout of shingles again, you'll notice, my dear, there'll be a bunch of those kind of scabby margins all the way down. You don't wait for that one to get you in. If that's okay.
Great, thank you.
With shingles, my dear, we don't mess around with that stuff, okay? Because the last thing I want you to do is ever lose your vision from it, okay?
Yeah, I've heard things.
Good. Well, good. Hopefully they scare you enough to bring you back, okay? All the way up one more time, my dear. But you'll notice that your lid margin will look less red and irritated once you start this treatment here with me, okay? Good. Good job, hon. Go ahead and blot your eyes one more time, hon. You're very dilated, so let's take a peek, okay? But typically, my dear, since you're over the age of 60, I typically recommend an
That's for
annual
sure.
appointment. Older and wiser, okay? For most of my patients, I typically recommend an annual appointment so we can catch things sooner rather than later too.
Okay, sounds good.
All right, hon, drop your chin into that chin rest for me again. Sorry if it sits a little bit low, okay? Feel free to blink. Good. Yeah, my dear, the front surface, my dear, both eyes are just dry, so this will help, okay? Blink for me again. I'm surprised that you're not noticing that weird foreign body sensation out of the other one, too.
I
Okay?
might be, but
Yeah.
I don't want to whine.
It might be just worse in the left,
Mhm.
yes. Go ahead and look straight ahead. The nice thing, my dear, is not a single vesicle, so you make me less nervous that it's zoster, though, okay? Go ahead and blink for me if you can. Good. Yeah. Perfect. I'm going to switch over to white light really quick, okay? Yeah, I definitely think you might have accidentally rubbed the eye, my dear, because there's a teeny tiny boo-boo towards the kind of, that same area that we were looking at before, okay? So mild. Perfect. So what I want you to go ahead and do is you're gonna look straight for me, and then we're gonna take a look at that cataract again. So on a scale between 1 and 4, 4 meaning you're ready for cataract surgery, I put you at a 2, okay, hon? So the cataract is growing a little bit. I'm gonna hover a lens, my dear. Feel free to blink whenever you need to. You're fine to my ear. But try that artificial tear, my dear, 4 times a day. I know you've only used it 4 times since picking it up, but the increased frequency will definitely help lubricate that area too for
Okay,
you,
great.
okay? Fine to my ear, hon. Sorry about that. I know that was kind of obnoxiously loud there. Okay, good. Your optic nerves look beautiful. We typically grade on a scale between 0 and 1. Closer you are to 1, the more nervous I get about a disease known as glaucoma, my dear. Yours is about a 0.35. Not big, not small. You're looking great. And no signs of macular degeneration. You're doing awesome. Okay. Please find my other one, but you can blink. I'm so sorry if I didn't tell you, though. What I always tell patients is you're doing awesome. This one's a little smaller, just like we have one bigger foot, one bigger hand, one bigger foot. This is about a 0.3, but looks really healthy. Sit back, you're doing really, really well, okay? So 0.3. Sorry, honey, if I don't write this down, I won't remember, okay? So
No, please, take your time.
And one more set, my dear, and then you are all good with me. Because you've been a little bit bothered in that left eye, I might just recommend a small little antibiotic ointment for a week there, okay? So we'll use that instead of this ointment, and then we'll add this ointment afterwards, okay?
Okay.
I think it'll just be a nice protective barrier so it can't get worse there too. Okay? Which pharmacy am I sending it to?
I usually use the one,
Beautiful. Beautiful. So what I'll do, my dear, is it's same thing. You'll pull down your lower lid, my dear. You'll squeeze that same ointment in there. You're gonna apply it to that lower portion for 7 days. I'm just doing it just because that little boo-boo, my dear. I want to make sure it doesn't get infected there
Okay.
too. Okay.
Thanks.
But afterwards, you can definitely use this other ointment. It's totally fine.
Okay.
I think overall, just helping with the dryness will be perfect. But I sent the medication already over, so by the time you're done, it should be all ready for you too. Okay. We have one more set, my dear. I always tell patients it's like a big old microscope on my head. It's gonna allow me to look all the way inside.
Very stylish.
Oh, you know, we try here at the eye department. And then if everything looks good, David, you look great, okay? But if things get worse, you know who to call, or myself, my dear, okay?
Okay.
It's easiest to message us through my charts if you're okay with that. Only
Yeah.
because our call, my dear, you know our call line is horrendous, okay? For any department, honestly, okay? When you're ready, you're gonna come towards me a little bit, and with your eyes, you go all the way up towards the ceiling for me. Open, chin
just the
down.
eyes.
There you go, sorry, just because I'm a little bit on the shorter side, okay? Good, all the way up for me. Good, up and towards your right for me if you can. Great, up and right again for me. Good. Up and towards your left for me, my dear. Good. Up and left again for me. Good. I'm gonna drop your chair a little bit, okay? Up and more still. What you're gonna do is you're gonna keep your head here, but you're gonna look towards your left for me if you can. Great. Your left again for me. Good. Your right for me if you can. Good. Your right for me. Sorry to boop you in the nose. You're gonna go ahead and find my fingertips. Brightest one in the bunch. Looks like you're looking directly at the sun. Okay, you're gonna find these fingertips. Good. You're very easy to work with. The last three, okay? If these look good, you get a very clean bowel health from me, okay? We just gotta fix that little boo-boo on your front surface. So there is 3 layers on the front surface of the eye, the epithelial, the stroma, and the endothelial. You actually broke a little bit of the epithelial. So every time you blink, you'll feel a little bit uncomfortable there too. You'll feel like, gosh, not that it hurts, but you're like, there's just this weird kind of mild soreness to the eye there, okay? And that's what's going on because it's
Did I do that with my finger, or
you could
rub
have,
it in
my dear.
bed? Or?
So sometimes some things can get caught in your lid, and if you're rubbing them, my dear, it can just kind of rub and break that little portion. It's very small. If I had to be honest, it's probably a little bit smaller than the size of the pen tip. But the reason why it's so bothersome is every time you blink, it's almost like ripping open a wound again, okay? So we're trying to give you a small barrier over it, okay?
Cool.
You're gonna go ahead and keep your head there, but turn it down for me if you can. Okay, I'm gonna touch just a little bit. Good. Down again for me. Down into your left. Good. Down and left again. Oh, sorry about that. Down into your right for me.
No, that's fine.
Down and right again for me. Good. So let's try this regimen. I also think it's going to help with the redness in and around your eyes there too. Okay. Good. Sorry, I just need to write this down because I won't remember here. Okay.
Oh, no.
But I think you're doing great. Ever have any other problems later, you come back. But I think you're doing just fine here too. Okay.
I appreciate it, doctor. Thank you.
Okay. So, if you're feeling better, my dear, there's no other complications. It's always once every year with us to kind of get you all squared away there too. If you want new glasses with us eventually, my dear, because it's been some time. Do you see another eye doctor on the outside world, my dear? Do you see another optometrist?
Yeah.
You do? Okay.
Yeah, my wife has had this person she likes for a long time.
Beautiful.
But I think they're retiring, so
Well, you're welcome to come see us if they are retiring, okay? But here is that whole bit there, my dear, that I want to kind of give you.
And this will also be on my chart, right?
Will be on my charts, my dear. I'm pretty good about finishing it during my lunch period. I do have about 3-4 more patients to kind of get through.
Oh, gosh, you don't have to do this on your lunch for me. I'm in no rush.
So, but the medication will be already at the other clinic. They'll pick it up, my dear, and then, but it's once every evening, so I don't blur out your vision throughout the day. There too, okay. But it should feel better. Start using those drops 4 times a day and try all that kind of lid regimen. It'll help.
Okay, I'll work on all that.
Yes, beautiful. Okay.
Thank you so much, doctor.
No problem. Have a good one, okay?
You too.
Bye.